Hello, this is Dr. Lewerenz. Hope you are well, and I hope this actually educates you further. Here at Longevity Health Institute, we're always bringing you the best in personalized functional medicine, and we're always, looking a little bit deeper. And I want to speak of three truths about inflammation, things that I see here all the time, and things that often frustrate me because of how much I discuss it, express it. In fact, somebody today very insightfully said to me, gosh, do you have just a repeat button? Like, let me just push this repeat button so that I don't have to keep saying it. But, when you're passionate about something and you're doing the best and you're really, really focusing in a purpose-driven way on improving the quality of life and health for all, and that's what we do here at Longevity Health Institute. Me and my practitioners are always going to, educate. We're always going to, constitute a program, a protocol. We're going to be very personalized. We're going to try to really get the, experience and traction and knowledge and understanding that you need so you can be successful, but also keep you accountable. That's very key, okay? So kind of like a coach, if you will. But let me tell you about these three truths, okay? One is about inflammation. The underlying kind of message here is about you want to reduce inflammation. You don't want inflammation in your body anytime, and anything that can cause inflammation create all bad stuff, just period. Remember that. And also remember this too, just because you're not labeled with a disease yet, okay, just because you're not labeled diabetic, cardiovascular disease, maybe hypertensive, autoimmune disease, Crohn's, digestive trouble, etc., you could be on the spectrum of this. What that means is you don't just end up with the disease. The disease is a damaging organ physiologic process before you end up with the disease. So keep that in mind, because a lot of us don't think that way. We think, oh, I'm good. The doc said I'm fine. He gave the blessing. Move me on. See me next year. I'll check your lipids. Whatever. But my point here is that you have to act and react before the disease process expresses itself, okay? And that's called epigenetics, and that's what we do here, is work on your foundation of health and epigenetics. But back to inflammation. Three truths, three things that often get overlooked and aren't appreciated, and are causes and then end results when you have inflammation. Okay, one is men. Heart disease, heart attack, strokes, and even death, okay? I promise you, if you have inflammation in you and you're a man over 50, okay, you are running a huge risk of cardiac events, okay? And I mean even death, and I'll tell you a story here at the end in a second. But inflammation in your body for any cause, okay, when you have unstable plaque in arteries, okay, or you have any calcified underlining the soft plaque in your arteries, in your coronary arteries, in your carotids, okay, but anywhere in your body, particularly in your coronary arteries, when there's inflammation, that essentially is a fire or is a pressure that potentially can cause the release of that plaque and cause a heart attack or a stroke or a pulmonary embolism or imminent death, if you will, okay? Point being here is that inflammatory responses in your body have to be addressed. Okay, and that could be any type of inflammatory response. Often inflammatory responses come from bad diet, bad lifestyle, being obese and overweight, infections, chronic infections, if you will. But I'll tell you a story from a patient that just told me today, and this is the scary one, but I've seen stuff just like this. Again, a lot of men over the age of 50, okay, very common. About 70% of men are on a hypertensive men in the US, okay, over the age of 50. Okay, that is the early signs that on the spectrum of the start of coronary artery disease, okay, or of potential coronary artery disease. You have to have that stuff looked at and appreciated. But a patient's friend of mine, okay, only 52 years old, actually died of a massive coronary event, massive heart attack after cutting the lawn. Okay, and according to him and family and all that, relatively healthy, okay, because he ignored some symptoms in that. He was a little overweight, drank a little excessively, but not over the top. And for about a week, he was complaining of being tired and short of breath, etc. But 2 weeks, so he had some inflammation in his body. I can guarantee he had an inflammatory response in his body. But 2 weeks after, or excuse me, 2 weeks before he had the fatal cardiac event, he actually had a COVID booster. And that is basically an inflammatory response that's going to start and happen in your body. I don't think it's coincidental, but I think that inflammatory response aggravated the inflammation that was already there and probably released the plaque, okay, and caused an infarct, which is a heart attack, and it caused his imminent demise. So any inflammatory response can affect your heart and vascular system. And this is all of us men and women, but especially men in their 50s and above, these early cardiac events that are shocking and destroy families and just, are very, very, very shocking to anyone to hear. Somebody so young could die so suddenly. But I've been present with somebody even younger than that I had to resuscitate because of a cardiac event. And yes, he had a cause of inflammation, and that was being significantly overweight, okay, and some lifestyle stuff, okay? So I want to really let men out there know that you have to take this serious. You have to really appreciate things that can cause inflammation in your body. Have your doctor check your CRP, your ultra sensitive or highly sensitive CRP, which is an inflammatory marker, which I cover in other videos, but also appreciate the fact that you could be on the start and on the spectrum, on the pathway of developing early microvascular or coronary artery disease. Second thing is that causes inflammation is gut and gut health and gut lining. You hear me talk about leaky gut and irritable bowel syndrome and all these things, okay? But what is the problem with those is that they create an inflammation in your body. They create an immune reaction in your body, okay? And one of the root things that we always fix here is gut health and diet, because when you get to that healing process of the gut, you reduce all your inflammation besides help so many other processes in your body. But always understand, if you have heartburn, if you have reflux, if you take anything for your stomach, if you bloat, if you're constipated or have diarrhea or have bowel irregularity, okay, and some of these things are just well accepted out there and people just live with them, you have to have this fixed so that your inflammatory response goes down. Because understand, just like your skin, the biggest organ in your body, okay, and we care about how that looks. We care about, the blemishes and the freckles and the sun damage and all that stuff. That's an organ, okay? Just like your heart's an organ, just like your lungs are an organ and your brain's an organ, etc. Your gut lining, that small millimeter lining in your gut, that if laid out is bigger than a tennis court, okay, excuse me, is an organ. That is an organ. You have to appreciate that organ degrades and ages just like your skin and just like everything else, okay? And you have to take care of it. And you're taking care of it by a good diet, some good lifestyle things, keeping your weight down, and that will keep inflammation down so that you can ultimately, okay, have good health, okay? But remember is that when you're inflamed and you have a high, again, CRP is a simple way of testing it. You can guarantee you have some very likely gut stuff going on, or at least you want that looked into, okay? The third thing is that what is a most common cause of inflammation? You know it, you hear about it, it's an issue with everybody, including myself. Every once in a while, we want to look in the mirror and get better, and that is your weight. Usually we're talking about significant weight though, but anything with a higher BMI, which I hate BMI as far as a marker because it doesn't account for muscle and being fit and etc. Okay, having more quality mass. But anything that is above a high BMI, 30, 32, 33, 34, potentially, I just want you to consider that. But being overweight should not be acceptable, okay? And just because you've been overweight your whole life should not be acceptable, and especially obesity, okay, is very, very significant to cause inflammation and all cause mortality, morbidity, illnesses, etc. Everything. Cancer higher in obese people, heart disease higher in obese people, diabetes higher, okay? But having excessive significant weight, don't fool yourself, will cause an inflammatory response chronically in your body, and it sets you up for a lot of chronic diseases and risks. Things that with aging, you're surely not going to feel well, thrive, and hopefully you will survive, but it can even cause your demise. So getting to the root cause, and these are common places where we'll find inflammation, okay? But just that's why eating right, having the right diet, having the good gut lining, and appreciating your inflammation in your body can save your life, literally save your life, Okay, so take a moment, talk to us here at Longevity Health Institute, talk to my other practitioner and providers. We have a full staff here, always bringing you the best and functional personalized medicine. Okay, 2 locations in here in Michigan, and always taking new patients and hopefully educating you and bringing you some knowledge and some then personal reflection on how you can help yourself be healthy. This is Dr. Lewerenz, Longevity Health Institute. Be well.